Welcome to the deep dive. Today we're diving into this article from The Advocate
Okay.
called "What Does a New Trump Term Mean for Gay Men and mpox?"
Right.
It really touches on a lot of stuff that I think is very relevant right now: healthcare, politics, LGBTQ plus issues. So let's see what we can uncover.
Yeah, you're right. It's a fascinating intersection,
Hmm?
especially with, the recent mpox outbreak
Yeah,
and then this upcoming election.
exactly. It's
well,
always
very timely.
Yeah, and the article starts off by highlighting this study from the Medical College of Wisconsin.
Okay.
That found something kind of surprising. It turns out that gay men actually report a higher level of trust
Oh, wow.
in medicine than other groups, even other minority groups.
Mhm.
And I thought that was really interesting, especially when you consider, historically, healthcare disparities, the AIDS crisis.
Yeah, it is striking. And the article kind of suggests that maybe this higher trust is rooted in, the legacy of AIDS activism.
Right.
During the AIDS crisis,
Yeah.
the LGBTQ plus community, they had to fight for access to treatment and research and even just basic recognition from the medical establishment,
Yeah.
and that experience, it forced them to engage with healthcare systems in a way that many other communities, hadn't had to,
Right.
you know.
It makes a lot of sense. It wasn't just about seeking care. It was about
Right.
demanding it, pushing for change,
Absolutely.
becoming their own advocates. Yeah.
And, you can see how that kind of activism would shape a community's relationship with healthcare, over time.
Absolutely.
It makes sense.
Yeah, and it's not just about the past either. The article also points to the impact of pre-PP,
Right.
which is, the medication that can prevent HIV infection.
Huge.
That's been a game changer, I think, for sexual health within the gay community. And it's a tangible example of the benefits of engaging with medicine
Right.
and taking, proactive steps for your health.
Yep.
So we've got this backdrop of high trust in medicine within the gay community. But then the article goes on to raise some concerns about what a second Trump term could mean
Yeah.
for mpox prevention and treatment.
Yeah. One of the main worries is the potential impact on access to pre-P.
Mm-hmm.
The article actually mentions this court case in Texas,
Okay.
where conservatives are challenging the Affordable Care Act's requirement that, insurance plans have to cover preventative services,
Right.
including pre-P. And they're arguing that this requirement, it violates their religious freedom.
So if they win, that could set a precedent for other states to kind of,
Oh, yeah.
deny coverage for pre-P.
Absolutely. And that would be a huge setback for HIV prevention efforts.
Right. To understand the full scope of this case, though, I think we need a little bit more background on pre-P itself.
Okay, yeah, sure.
Yeah.
So pre-P stands for pre-exposure prophylaxis, the daily medication that's highly effective in preventing HIV infection.
Right.
And, the Affordable Care Act mandates coverage for pre-AP as a preventative service. But this court case in Texas is directly challenging that.
Right.
So it's a really crucial case to watch.
Yeah.
Because it could have, widespread implications for access to this life-saving medication.
And it's not just about access to medication. The article also highlights concerns about vaccine production and distribution under a new administration.
Right.
We saw how, the Biden administration had to ration and prioritize mpox vaccine doses, especially in those early days of the outbreak.
Right.
Who knows what that process might look like under a different administration?
Yeah, the article doesn't speculate on exactly how a second Trump term might handle mpox vaccine distribution, but it does raise the question of whether certain demographics might be disproportionately affected
Right.
by, changes in public health policy.
And that's a big concern. I mean, the article is specifically focused on mpox and its impact on gay men. But the issues it raises are relevant to everyone. Healthcare and public health shouldn't be partisan issues.
Absolutely.
Everyone deserves access to quality care and effective disease prevention, no matter who's in office.
I agree 100%.
And speaking of mpox, I think it's worth taking a moment to explain exactly what it is
Yeah.
for those who might not be familiar, because the article, it assumes a certain level of familiarity with mpox.
Right. Not everyone's going to be up to speed on that.
Yeah.
So mpox was originally called monkeypox,
Right.
but the World Health Organization renamed it earlier this year. It's a viral disease that can cause flu-like symptoms and a distinctive rash. It can spread through close contact with an infected person or animal.
Okay.
The WHO actually declared mpox a global health emergency back in July.
Wow.
So it's something we need to be taking seriously.
Yeah, definitely. And that brings us back to the article's central question. What does a new Trump term mean for gay men and mpox? We've talked about, the potential concerns surrounding access to PrEP, vaccine distribution.
Right.
But the article also mentions another factor that could complicate things.
You're referring to the emergence of the clade I mpox strain in Africa.
Exactly.
Yeah. Yeah.
They say there haven't been any U.S. cases yet,
Right.
but it's something we need to be monitoring closely.
Absolutely.
Yeah.
Yeah. It's a reminder that we can't afford to let our guard down, especially when it comes to emerging infectious diseases.
Right.
We saw how quickly the initial mpox outbreak spread and, how unprepared we were as a nation.
It's true. It makes you wonder, are we really any better prepared now? I mean, how would a potential second Trump term affect our, public health infrastructure and our ability to respond to outbreaks like this?
That's a really important question. And the article doesn't really offer any easy answers.
Right.
But it does highlight the role of misinformation and conspiracy theories in, fueling distrust in medicine and undermining public health efforts.
Yeah, they specifically mention Robert F. Kennedy Jr. and his, anti-vaccine rhetoric. It's scary how easily misinformation spreads and influences people's decisions.
Yeah.
Even when there's clear scientific evidence to the contrary.
Exactly. And that's why it's so crucial to have trusted voices, like Dr. Daniel Hughes, who's quoted extensively in this article.
Yeah.
He's not just advocating for vaccination, he's urging people to be critical of the information they're consuming.
Right.
And to seek out reliable sources. So he's really emphasizing the importance of, informed decision-making.
Yeah.
Especially when it comes to your health.
It's about empowering people to take control of their own health and well-being.
Absolutely.
And that's especially important in times of, political uncertainty, when healthcare policies and access to resources could be in flux.
100%. And it's not just about individual empowerment.
Right.
We need systemic change.
Yeah.
We need policies that protect access to healthcare, promote public health, and prioritize, scientific evidence over misinformation.
So we're talking about like a two-pronged approach.
Yes.
Individual responsibility and systemic change.
Exactly.
They both have to work together, right?
Yeah. It's not either, it's both hand. We need individuals to take ownership of their health and make informed choices. But we also need a system that supports those choices and makes them possible.
And the article seems to suggest that gay men with their history of activism and engagement with the healthcare system might be particularly well positioned to navigate these challenges.
I think that's a fair assessment.
Yeah.
The article actually cites a study that found that gay men are more likely to have regular healthcare providers and to be up to date on their vaccinations. They're also more likely to engage in open communication with their doctors about their sexual health.
So this higher level of trust and engagement with the medical field could actually be a strength?
It could be, yeah.
In the face of potential policy shifts and public health challenges.
Exactly. The article highlights how the gay community's proactive approach to sexual health, particularly with regards to HIV prevention and treatment, has yielded positive results.
Right.
They point to the success of pre-EP in reducing HIV transmission rates.
Right. Pre-EP has been a game changer.
Yeah.
And it demonstrates the power of combining, individual responsibility with access to effective healthcare.
Absolutely.
Yeah.
However, the article also cautions that even with this proactive approach, there are still concerns about how a second Trump term could impact the LGBTQ plus community's access to healthcare and resources.
Right.
Specifically regarding mpox.
Yeah. That's where this clade I strain comes into play.
Exactly.
We don't know how it'll behave, but it's a reminder that we can't become complacent.
Exactly. The article mentions how the initial mpox outbreak kind of caught many people off guard, both within the government and the general public. So there's concern that we might not be as prepared as we should be for another outbreak, especially if there are changes to public health funding or priorities.
Yeah, the article doesn't delve into specifics about potential policy changes under a second Trump administration.
Yeah.
But it does raise a lot of valid questions. I'm curious to get your thoughts on the potential impact on public health infrastructure and funding.
Well, it's difficult to predict the exact impact.
Yeah.
But the article does allude to the Trump administration's previous approach to public health issues.
Okay.
Including, budget cuts to the Centers for Disease Control and Prevention.
Right.
And a general skepticism towards scientific expertise.
That's a worrying trend.
Yeah.
And it's not just about funding.
Right.
It's also about leadership and messaging.
Absolutely.
We need leaders who prioritize public health, who trust science, and who can communicate effectively with the public.
I completely agree. The article underscores the importance of clear, accurate, and consistent messaging
Right.
from public health officials.
Yes.
This is crucial in combating misinformation and building trust within communities.
And they also touch on the role of stigma and discrimination in hindering public health efforts.
Right. The article mentions that stigma surrounding mpox,
Mhm.
particularly early on in the outbreak, might have discouraged some people from seeking testing or treatment.
Hmm.
So this highlights how social and cultural factors can play a significant role in shaping people's healthcare decisions.
Yeah, it's a reminder that public health isn't just about science and medicine. It's also about understanding and addressing the social determinants of health.
100%.
Things like stigma, access to information, and even cultural norms can have a huge impact on how people interact with healthcare systems.
Absolutely. And that brings us back to the importance of community engagement and advocacy.
Right.
The article emphasizes the need for continued activism within the LGBTQ plus community, not just to advocate for their own healthcare needs,
Yeah.
but also to combat stigma and misinformation within society as a whole.
It's about being proactive, being informed,
Right.
and demanding better for yourself and your community.
Right. It's about recognizing that your health is interconnected with the health of your community and society as a whole.
So even though this article focuses specifically on mpox and its potential impact on gay men under a second Trump term,
Yeah,
the issues it raises have broader implications for everyone.
absolutely. Access to health care, the fight against misinformation, the importance of public health infrastructure, these are issues that affect us all.
Right. The article doesn't offer any easy solutions.
Right.
But it does provide a framework for thinking about these complex issues
I agree.
and understanding the stakes involved.
It really does.
It's a lot to think about, especially as we head into this election.
It is, and the article doesn't shy away from that.
Right.
It really encourages readers to consider how the outcome of the election could impact access to health care and public health initiatives, not just for the LGBTQ plus community, but for everyone.
Yeah, and it's not just about voting, right? It's about staying informed, holding our elected officials accountable, and being active participants in shaping the policies that affect our lives.
Exactly. The article doesn't explicitly call for, specific policy changes or anything,
Right.
but it lays the groundwork for that conversation. It highlights the need for a comprehensive approach to public health that includes, robust funding for research, prevention programs, and access to care,
Right.
as well as measures to combat misinformation and address the social determinants of health.
And it also emphasizes the importance of individual actions, right? Things like getting vaccinated, practicing safe sex, and staying informed about, potential health risks.
Right. The article quotes Dr. Hughes, again,
Yeah.
who offers some really practical advice for navigating sexual health in the context of mpox.
Okay.
He encourages open communication with partners about sexual history and potential exposure to the virus.
Yeah, I think that advice applies more broadly too, It's about creating a culture of honesty and transparency around health,
Right.
where people feel comfortable discussing their needs and concerns with their partners and healthcare providers.
Absolutely. And it's about taking ownership of your own health,
Yeah.
staying informed, asking questions, and making choices that prioritize your well-being.
So it's a combination of individual responsibility and collective action.
Yes.
We need to advocate for policies that promote public health, but we also need to make informed choices in our own lives.
That's a great way to put it. It's about recognizing that we all have a role to play in creating a healthier society.
Well said. I think that's a great note to end on. So what are the, key takeaways from our deep dive into this Advocate article?
I think we can distill it down to a few key points. First, gay men have this unique relationship with healthcare,
Right.
marked by a higher level of trust and engagement.
Yeah.
This is a valuable asset in combating health crises like mpox.
Second, political shifts can create uncertainties and challenges when it comes to healthcare access and public health initiatives.
Absolutely.
And third, proactive measures like vaccination, communication, and awareness are vital in navigating sexual health, especially in a changing political landscape.
Very well said.
Great summary. Thanks for joining me on this deep dive. I hope it's given you some food for thought as we navigate these complex issues. And as always, we encourage you to continue exploring these topics and engaging in the conversations that are shaping our world. Until next time.